Maxi Strobl, who is from Imperial, very newly arrived there, I believe. And he's going to talk about what preclinical experiments can teach us about mathematical model-guided treatment scheduling. Thank you. Hopefully. Yes.
Thanks very much for the invitation to speak. I'm Maxi. I used to be a postdoc with Jacob Scott in Cleveland, as Helen mentioned, since 2 weeks I'm back on this side of the pond. I'm a research fellow now at Imperial College and the ICR. With that said, the work I'll be presenting here is from my postdoc with Jacob. It's great to be talking after Sandy because he basically did the intro for me already. As you're all aware, cancers are very complex and they are constantly changing as we treat them. And we're starting to take that into account when we decide what drugs we use for treating. So for example, we might choose drugs that target specific mutations in a tumor. But we currently do very little when it comes to taking into account what this might mean for the scheduling. And most patients basically receive the same dose, frequency, and duration of treatment. And we essentially try and give as much drug as possible to kill as many cells as possible. But as Sandy has already kind of alluded to, we can do better than that. And there's several reasons for that. One is that the effect that the drug has, both in terms of the short and long term, are different. And there's opportunities here for maybe being able to steer tumor evolution through scheduling. There's, of course, effects on toxicity, and potentially there's opportunities here for us to de-escalate treatment in certain patient groups. And then finally, there's a big question about what are we trying to achieve with this treatment? Are we really trying to cure, or is it, for example, in the palliative setting where we're trying to control? Or is this a neoadjuvant setting where we're really trying to set ourselves up for the next step in a regimen, and it's like a long-term strategy? And all of these are things that might influence how we schedule and make this a complex multi-objective optimization problem. And so, broadly speaking, I'm interested in what can we do with mathematical models here, try and integrate these different pieces with data and come up with more personalized treatment schedules. There's 3 questions really that sort of my research orients around. One is, what are the models we want to use? What are the adjustments we want to make? And then finally, I think probably most closely for this workshop is the question of how do we validate these schedules we come up with before we move into the clinic. And this is really what motivated the project that I present here, which I did with Jake in Cleveland, where we essentially tried to test intermittent scheduling and adaptive therapy in a lung cancer cell line with an EGFR inhibitor. We took sensitive cells and resistant cells, colored them, and then treated them with different treatment schedules and used a real-time microscopy system to watch them live and see how the population dynamics changes. Where essentially we can use intermittent schedules to delay the outgrowth of the resistant cells. And then in parallel, do some mathematical modeling and see how well these models line up with the dynamics we're seeing in the dish here. And here's some of the data. So the left-hand side is no treatment. In the middle is the continuous high dose treatment, and on the right-hand side is an intermittent schedule. The arrows point to 2 resistant colonies, and you can see how in the continuous case, the colony kind of expands over time, and then on the right-hand side, we kind of, with the intermittent schedule, we see this trapping, kind of like what the models in theory are predicting. And we can look at the end and then see there's a difference in the resistance fraction, and when we do the statistics, we see that holds true as well, and the intermittent scheduling really works here. The other thing that's kind of interesting is, as I said, we did a bunch of different schedules, and we see there are differences here in how they work, and specifically, even though we're giving the same, if you give the same dose continuously, so it's less dose in total, but it's the same as in intermittent, it doesn't do as well. So it really is about how we schedule, not just the total amount of dose we give. We also played with the dose levels, so basically repeated this at different dose levels, and found that the intermittent schedule works best at intermediate dose levels. And moreover, and especially for me as a mathematician, what I found really striking was the dynamics you see in these cell lines in response to intermittent schedules at different dose levels changes. And this really segued me into this next piece where I started to take some of these models that I and I know others here have been playing with in this field and look to see, can they predict what is happening here? So what I did is I started off, for example, with a logical Terra model, fitted it to my control untreated data and to my treatment data. So now I have all the parameters. I know everything about what happens off and on treatment. Let me put them together. And what I see is it doesn't work. It works for the first cycle, but then it starts to diverge quite a lot. And I thought this was really striking in terms of telling us biology is not linear, and we might want to be, I think we need to be careful when taking these schedules and making these long-term predictions. For me personally, of course, raised the question of what's going on here. And the hypothesis that we're investigating here is the idea that they're actually starting to change these sensitive cells. And Sandy was talking to this as well, this idea that as we treat, we're changing what we're treating. And so I'm quite interested in, and been playing with models here of drug-induced tolerance. And if you're interested in finding out more, come and see me at my poster. And just to briefly wrap things up here, I think my pitch is, I think experiments have their limitations, but they, in terms of developing these models, allow us to fail safely, quickly, and informatively. And I think that's a big plus. We see here, in this experiment at least, that we can use these intermittent schedules to delay resistance, so there is an effect of scheduling on tumor evolution. And I also think that it's important to rethink our models of how these tumors really respond to drug, and that maybe these models need to be a bit more complex because there's dynamics that are going on. And I think those are especially important once we do these more complex on-off type schedules. Thank you.
Thank you. Thank you very much.